Always good to see Dr. Bob Arnot, the award-winning journalist, best-selling author of more than a dozen books. We welcome him to this edition of PoliticKIng. Bob, what do you make how well we've handled this coronavirus? Was this level of deaths inevitable?
It really wasn't, Larry. Back in late December, Xi Jinping had hundreds and hundreds of thousands of masks, thousands of ventilators being bought up in China because they realized they were going to hit the big one. All of the epidemiologists, all the WHO, CDC realized we were going to get hit and hit hard. I think especially in New York City. There are, tens of thousands of deaths that need never have happened. They'd simply closed up earlier, like Los Angeles. We could have prevented a lot of those deaths. Always tough in a situation like this, Larry. You just can't imagine it's going to be as big as it is. But I would say, look at what we missed. We missed having any kind of testing early on, so we didn't realize how many cases were coming in from New York into New York City. We didn't realize what the prevalence was in New York City. We didn't have any background testing. We call serologic testing. It's 1% of the population or 5 or 10%. We had legion numbers of doctors and nurses die because they simply didn't have the right kind of N95 masks. We had the wrong ventilator protocols. So you had thousands of people dying on ventilators that needed it. So I would say across the board, we blew it in terms of those numbers of cases. Now, where do we win? I think with the ventilators, we won in the sense that they did gear up, they did get enough. They got some from China and Oregon and California into New York State. So there have been some wins there. I think that we now have a drug, remdesivir, which is not great, but does decrease the amount of illness for somebody who's on oxygen, not someone who's sicker. So it's a mixed picture. But to answer your question very directly, I think there are tens and tens of thousands of lives that could have been saved if we were early and on it, as we could have and should have been.
How, in your opinion, are we handling the reopening?
So I think we're handling it very poorly. Here's the reason. It's quite clear that reopening is the wrong word. In other words, if you go industry and business by business, they're incredibly smart people who have figured out how you can run things without infecting people. For instance, I just took my 7-year-old to a camp. They're meeting outdoors. They're on bikes. They're 6 feet apart. They have masks on. They're going out into the woods. That's going to work. We've seen, automobile factories like Arnot that, has people far enough apart. They have the glass barriers. They thought it out. The time and energy, Larry, should have gone into planning on how you open up the businesses that allow the economy to survive. Open up, unfortunately, has been translated into belly into the bar. You saw Lake of the Ozarks with hundreds of people out in a pool, people going to car racing. The rules of this virus are very, very simple. It's distance, 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 and we're not seeing that. Open up has come to mean some kind of political ideology where we're revolting against the virus instead of just being really smart about it. And I think you're going to see a big pushback. You're going to see in the Southeast, thousands and thousands of new cases. And of course, with these riots that we've had, you're likely to see big bursts there. So I think that we've used the wrong terminology and opened up. We should have just been smart about getting the economy going by just paying attention to the rules that the virus is providing for us.
Do you expect a new wave then, based on the riots? We'll have a new wave of the coronavirus back?
So, Larry, I do. I think, one mistake is that when you look at China, they came all the way up to where we were. They dropped down all the way to 0 cases before they opened up. We've only dropped about half, maybe 2/3 of the way down. And then you have the riots, you have the opening up in some of the southern states, you have the active revolt there. So I think we're going to see some spikes. And the really smart disease modelers are saying that we're going to see lots and lots and lots of mini spikes between now and 2022. So is this going to be with us for a while? It's a coronavirus. There are 4 others of those which are common for the symptom, the common cold symptoms. Those circulate the globe all year, every year, and it's likely that this will be the 5th and will continue to circle the globe for many years to come.
How about the drug the president is taking, hydrochloric, I can't pronounce it, that drug? What do you make of it?
So the The simple way to go is called Plaquenil. I've taken it. You know, it's an anti-malarial. It's a very good drug. I've prescribed it for lots and lots of patients who have arthritis. It's a good drug. So a couple things to say about it. First of all, it causes a lengthening of the EKG called the QT part of it. And when that happens, it puts you at risk for sudden death. So one thing hospitals are starting to see is a lot of arrhythmias with that drug, and if it's used along with azithromycin. So I think you have to be careful to look at what were the studies done. There's a study that's done on very severely ill patients, and 28% of them died with it, and about 11% died without it. So it doesn't work for severe disease. Mild to moderate disease, they did another study looking at how fast do you get rid of the virus, and in that study, there was no difference. Didn't seem to work. Now, the president was taking it for an interesting reason, and that is, could it prevent the virus? And, you know, theoretically, because the spike protein it uses to attach is affected by the drug, and also once it gets inside part of the cell, the acidity, it doesn't get as acid with the drug, so it may not replicate as much. Theoretical reason, there is a study now looking at prevention, we just don't know. But the watchword is, don't just start to take this drug willy-nilly. Wait for results on that. We know the remdesivir, if you're very sick, is now approved by the FDA and is a better bet. But the Plaquenil is something I would stay away from unless some good studies come out. And, you know, there's lots and lots of clinical trials, and we should know soon.
What's your bet on how soon we'll have a vaccine?
You know, I think we're going to have it sooner than later. They've had some, you know, problems with the Oxford vaccine. I thought it'd be early fall, but here's what they've done that's interesting. First of all, it's not, they had generated as many antibodies with the vaccine already as you get with the infection, which is very good news. Now, will there be some kind of terrible side effect? Are they effective? We don't know that piece yet. But because they're investing billions of dollars in plants to be able to make these, as soon as one of these really proves out, they'll be able to get tens of millions of doses out. So, you know, my bet is that rather than the year and a half that Fauci talks about, I think with all the innovation that's going on now, though, you know, we'd have one. I'm betting we'd have one by year's end, if not earlier.
What do you make of the president's having us leave the World Health Organization?
So there are two sides to that story. Side one is the World Health Organization really soiled itself with Ebola in West Africa. They had a lot of political appointees out there. They weren't early enough in warning, and they did the same thing with this virus. You know, they probably did cozy up to the Chinese. We didn't get enough of a warning. They talked about cutting off air travel is a bad idea. So on the one hand, I think that they really have, and now they're talking about maybe masks don't work when we're trying to get everybody to mask up. So I think they've really hurt themselves badly. However, the World Health Organization holds together much of African health, where you have, you know, potentially hundreds of thousands of lives to be lost. So I think it's too bad not to continue to fund that. But I certainly understand the anger towards the World Health Organization in terms of not really warning us loudly and clearly enough to get the tests out, to get all of the protective gear, the vaccines and whatnot. They're the early warning system, and they failed like everybody else did.
Do you think there's an accurate number of cases that we know about right now?
So I think that's true. You know, they think that in China you may have had, you know, tens of thousands of more deaths than they've actually told us about. You know, lots of governments are going to suppress death data. Here in the United States, you know, in a place like New York City, one day I remember there were 282 people who were pulled from their apartments dead. And so there are many numbers of deaths that I think that weren't counted, that should have been counted. So I think that the absolute number of deaths is higher. Now, there's an interesting thing, though, which is what is the death rate? You have what they would call a case fatality rate. In other words, you admit so many people to the hospital and so many die. And there it would look like you might have 4, 5, 10% death rate. But the actual death rate, if you were to test everybody in the population, might be as low as 0.3 or 0.4%. But without that background testing, we really don't know. We're left with the case fatality rate, that is, the numbers of people who are sick and how many of them died, which is that 5 to 10% figure, rather than the overall population figure, which is likely to be 0.3, 0.4%.
Mental health experts are saying we'll see an increase as a result of this in depression and the like. You agree?
So, Larry, already we're seeing figures that up to 80% of the American population is already depressed and showing signs of depression. So, listen, it's a terrible era for a lot of people. I mean, I have sons, three sons, one's 31, one's 25, and they're going, where's our career? What's going to happen to my job? They already had one big wham back in 2000, 2007, and 8 with the economy failing then. And this again, I mean, people are really concerned. You have an increase in suicides, you have an increase in domestic violence, you have an increase in drug abuse. All of this because people are desperate. I mean, there is no way for many people who are in service industries to earn any money. The money's going to go away from the government. Unemployment's going to run out. So there's lots and lots to worry about. And I do agree that it's a double-edged sword in terms of the quote opening up. On the one hand, it's great to be able to drop the overall number of cases and keep it below what the healthcare system can manage. But on the other hand, you are seeing increased numbers of deaths from other illnesses. People are afraid to go into ERs. They're going into ERs, 48 hours after they've had a heart attack. The violence, the drug abuse, the alcoholism, all of that's going to, basically cause a tremendous amount of turmoil and may cause as many or more deaths as the epidemic itself.
Finally, do you expect us to be able to see sporting events?
So that's a great question. I do think, Larry, just like after 9/11, there's tremendous innovation in terms of security. We're going to see a lot of innovation in terms of biosecurity. As soon as the test comes out that is able to detect the virus in your breath, you're going to have sporting events. You'll come up just like you go through a magnetometer now, or a machine that scans you for weapons or whatever. You go through, you breathe, and they'll be able to say you do or you don't have the virus. I think also when you look at sports stadiums, you may come in 6 feet apart. You may be in every third seat. I think that there are ways to game out all these industries. It's just if you think of the old way of doing it, that's not going to happen again.
Couldn't agree more. Thanks, Bob. Thanks for being with us.
Thank you, Larry. Great to see you, as always.